So there are two more people coming, but they'll get here when they get here, and we'll get rolling. So I'd like to call the November 25th meeting of the Hudson Mohawk Regional EMS Council to order. If everyone will please rise for the salute to the flag. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And if everybody would just stay standing for a moment and ask everyone to have a moment of silent reflection. First, some of you may know that Steve Retzloff, a member of this council, lost his wife this past weekend, Judith. And so thinking of Steve and his family. In addition, EMT paramedic Jana Schenk, also an active practicing paramedic in our region, passed away 2 weeks ago. So a moment of silent reflection in their memory. Thank you. All right, we have the minutes from the prior meeting were distributed by email to everybody. Are there any corrections to the minutes? Can I have a motion for approval of the minutes of the prior meeting? And we have a motion. Do we have a second? Second. Any discussion? All in favor? Any opposed? Any abstentions? Okay, the motion carries. We've approved the minutes. We have some excused members tonight. Scott Bowman, who is recovering from a knee replacement, isn't yet driving, but he says he's doing pretty well. Tracy Weir, Steve Piccato, Steve Retzloff, Dave Massaro, and Jim Stairs. Okay, Executive Director's report.
Okay, I'll hit on the high notes. Hopefully everybody has a copy. I'll entertain any questions anybody has. A lot of Remo outreach in the last month and a half, and it's been very well received. We set up tables at the EMS Leadership Seminar in Clifton Park. Just got back from one last Friday from the Columbia Green EMS Education Day. That's a great way to reach our people in the southern catchment area, the people that don't normally make it up this way, and it's always very well received down there. And for the first time, we set up a table and sponsored a table at the Albany Med Trauma Symposium. That went over really well as well. The important thing, we've been working with the town of Grafton and the towns of Grafton and the towns of Berlin relative to a transfer of operating authority. Berlin is going to give it to Grafton, is what I hear right now. I've spoken with the town supervisors of both those towns, sent them all the information they need to know or need to have to complete the transfer of operating authority application. I'm waiting to hear back from them. We're still waiting on Momentum Performance too. We sent the app into DOH. Dana Jonas there with his huge magnifying glass found a few deficiencies there. They're going to take care of those. So perhaps in the next month or two we'll be looking at 2 CON actions. Reminders for the advisories, the updates that went out. We sent the last one out a couple weeks ago. Nobody's called me since then and asked me questions, so I take that as a good sign that these updates are being completed and people know what they actually have to do there. In a nutshell, that concludes my report. Like I said, unless somebody has a question for me, I'd be happy to entertain it.
Tim, usually around this time of year, you ask us to provide something for holiday gifts for the staff. Has that already been done, or is that something that needs to come up?
No, sir, you're correct, and I have it listed under new business.
Okay,
Typically, at this meeting, I approached Remsco and asked them to approve $50 gift cards for the holiday staff.
So we'll get back to that under new business.
Okay.
Thank
All
you.
right. All right.
Okay.
And that's it.
All right, cool. All right, so for my report, start with thank you, Lynn, for collecting socks for the homeless, and thank you for everybody that have filled Lynn's box. That was very nice. There are a couple things on the agenda and a couple other things. The first thing I'd like to talk about is Tim mentioned our co-sponsorship of the Northeastern New York EMS Leadership Seminar that was held on November 18th. The seminar was quite successful. We had somewhere between 50 and 60 participants come to the program, which we did jointly with Mountain Lakes. I want to recognize Tim for his work in helping put it together. Also from our region, Doug Wildermuth and Nash Alexander. Both worked on that program as well as myself. Coming out of that program, we're going to do 2 webinars that will be follow-up that will be open to everybody in the region. And I think we probably, even though it's too soon to plan for next year, I think there was a feeling that doing something like this again next year would make some sense. It did break even at 50 people. We probably would have loved to have 75 to 100, so that's certainly the goal for next year, but it did come off very well. It was also fun to do something with Mountain Lakes. One of the things I'd like to mention tonight is that the Mountain Lakes EMS Council and their regional program agency, which is the counties to the north of us, is really starting to think about the long-term future and get involved in doing a lot of really fun things, or interesting and valid things. Their executive director, Travis Howe, myself and Tim have started talking about how it would be great for the 2 regional program agencies to begin working together more towards the future. If you remember, maybe 5 or 6 years ago, there was a question as to whether or not there were going to be 18 or so program agencies, or they were going to be collapsed. There was some talk about us doing something together with the North Country and also ARAMS. I think that Travis and Tim and myself all feel like we're 2 very strong program agencies, and we should be looking for opportunities to work together. So this conference was one opportunity to work together. I'd like to meet, Tim and I meet with Travis and his executive and his board chair in the next couple months to talk about other things we might do together, form some partnerships on some things. For example, they've got the Initial Assessments Conference up there, which is a really highly regarded EMS conference that has now, it's attracting people from all over the country. And we send people from our region up there, but maybe we can be, somehow a co-sponsor of that conference. We've done this leadership conference together. There's some other things that you'll see Mountain Lakes will come up once or twice more in this meeting on stuff we're doing. So I just wanted to let everyone know that I was hoping no one would object to myself and Tim. Just starting to have some meetings with them, find things we have in common. We also have to recognize that the ARAMS Council, which is 2 hours west, I don't think they have a really strong sense of what they're going to do for the future. Their executive director is probably around retirement age, and I don't know that they have planned a succession plan. So a lot of things will be happening in the regional council roadmap, and certainly we're a strong organization in that. Next thing on the agenda is the EMS well-being and mental health. This is something that has gotten a lot of attention in our region in the last month. It is publicly known that the EMS provider that passed away a few weeks ago chose to take her own life. And a lot of us in this room were present for the memorial service where her father, in his eulogy, talked a little bit about his daughter, but then he talked about all of us in the EMS community. He said, my daughter was really good at taking care of other people, but was not that good at taking care of herself. This is not the first person that I know of in our region that's taken their life that's an EMS provider. In the last several years, I know of 3. So though the other ones were not necessarily talked about as in this way, the families were not so public perhaps. But it is a reality that any of us that have been going to EMS conferences lately, and we talk about the stress of this profession, the fact that we are so self-reliant on ourselves and that we will not show our weaknesses. And statistics show that the EMS provider community and all public safety responders have a much higher rate of self-harm or feelings of self-harm than people in the general community. I look at my agency with 75 people, and I know that statistically speaking, there are a few people in that agency that are hurting, and I don't know who they are. So I think this is a real opportunity for us to show leadership as the regional medical organization. And I have asked some people to come together and form a task force that can report back to Remo on things that we can do in EMS well-being and mental health.
That task force so far is going to be made up of Lee Burns, retired Bureau of EMS director, who called me and asked if she could be part of it. Fred Fowler, another veteran paramedic in our community. Drew Anderson, who is a behavioral psychologist. He's a psychology professor at the University of Albany, who also is an EMT and rides actively as an EMT, as a volunteer. So he's been doing a lot of lecturing on this topic around the country at this point. Dr. Daly, Tim Mirable, and I've asked David Gardner of Mohawk Ambulance Service if he would provide either himself or a representative from Mohawk to be on this group. As Mohawk employs over 250 people in their EMS responder division. So they're a really big piece of our community. So if anyone is interested in being part of this task force, please do let me know. We're going to start meeting in December. Where it goes, I don't know. But clearly there's room for us to do something. We're a very robust organization with a lot of people that can put talents into this. In addition, the Mountain Lakes Regional Council is putting together, their Executive Director Travis Howe is putting together a multi-regional group to talk about this. And that he's invited us to participate in that, so we'll also be talking with them at a multi-region level. And maybe we can do things at a multi-regional level, or maybe we can do things in our region, but I think we ought to take Jana's father's advice and figure out how we can take better care of people, or our own selves, and hopefully be able to help someone before they reach a point where they feel like that, you know, they have no other choices. So, so it's a somber thing to be talking about, but I think it's important. If anyone would be interested in being part of that, just get in touch with me. All right, Innovative Payment Task Force. A number of things have been happening in Innovative Payment. First, the ET3 program has been pushed back. Now we're talking a spring launch of the ET3 program. Have any of the regions, any agency or region gotten any official communication? So I don't think there's been any acceptance of people into the program at this point. So I think we're all still waiting to find out who's going to be in, but I'm making the assumption that there'll be some presence from our region, hopefully all of those in the ET3 program. Payment Task Force has not met since our last meeting, but there have been some conversations going on that I think Dr. Daly can take the lead in describing a little bit.
Sure. So for those of you that are out there, please help me with the acronym. DSRIP.
DSRIP. Delivery System Reform.
Delivery System Reform
Incentive
Incentive Program.
Or
Thank you.
something.
Anyway, DSRIP. DSRIP is out there. There are two DSRIP programs in the region. One basically is the St. Peter's Ellis DSRIP program. The other one is the Albany Med DSRIP program. Both are designed to save money for the Medicaid population. We started some conversations with the DSRIP programs, working with them together, which they were pretty enthusiastic about the chance to work together, and how that could factor into alternative destination stuff, making sure people get paid along those lines, making sure that patients can get home. Those discussions are ongoing. We actually have a number of medical students, and including a couple with some business backgrounds, who are working, collecting some information to see how we can put this together as a package for DSRIP. There is nothing that's nothing concrete, just explored ideas, but basically we got a template from the feds. Let's see how we can apply this template to other opportunities that can get EMS paid for improving efficiency in the system, rather than people finding initiatives that will save money without leaving money for EMS. So we'll keep you posted as we move along.
The exciting thing about the DSRIP programs is they potentially bring financial ability to help make this happen with them. This is that $8 billion that the federal government has given to New York State to invest in EMS, to invest in healthcare transformation in order to lower the long-term costs. So if the DSRIP program does pick up a demonstration project in this area, it could be beyond the Medicare population that is in the ET3 program. Could be all payers, so, you know, Medicare, Medicaid, all private insurance. It also could be beyond the ambulance providers that have applied for ET3. It could be something that can be done region-wide. And the district programs come with some of that money to help plan it and make it happen. So that was sort of a very pleasant surprise to have both of them interested at the same time in doing something. So I think maybe we'll have something to report next month's meeting on that. So, okay. All right, so let's see. Last thing under my report is just a federal legislative update. The House of Representatives passed H.R. 1309, the Workplace Violence Prevention Act, last week. That is legislation that would provide resources for resources and recognition that workplace violence impacting EMS workers and other public safety professionals is a major problem. I think if you read some of the blogs and some of the newsletters, there are increasing stories about EMS providers being assaulted at work. I don't know if there is real increasing numbers or just increasing recognition, but every time it happens, it is certainly being noticed. It's happening all over the country. It passed by a pretty wide margin. Every single member of the New York congressional delegation voted in favor of it. It was mostly on a party line vote. All the New York Republicans crossed the line and voted yes. I think part of that is the fire department of the city of New York is very involved in trying to get passage of this legislation because there have been so many assaults against EMS workers in New York City. Now goes to the United States Senate, which has this congressional session lasts all the way until the fall, the end of the end of 2020, so there's a whole year in which to get it done. There's also another piece of legislation out there I wanted everyone to know about. It's called the Siren Act. It is a bill that was passed by Congress that will provide funding for rural emergency medical services. I think we talked a little bit about it last month, mentioning it. The U.S. Senate's put $5 million into the federal budget that is being worked on right now. It's not a huge amount of money compared to what was asked for, but it's a start, and that money would be divided up in a grant program that would be eligible to rural EMS providers across the states. Right now, the federal budget is in limbo, so they just passed a temporary budget last week that runs through December 20th. And you'll all see playing out between now and Christmas. You know, last year the government got shut down over the, do we build the wall, do we not build the wall discussion. That's likely to happen again. Our money is sort of going to be tied up in that discussion. If they can come up with a budget, and that $5 million will be probably in there, hopefully in there, if the House agrees, and then become available during 2020. Yes, Lynn?
5 million?
5 million.
For the whole country?
For the whole country.
For the whole country?
So not a real lot of money. The EMS profession, the National Association of EMTs, and I presume the American Ambulance Association worked on this together. They asked for 40 million. Usually legislation doesn't get passed. They did a really good job. It got passed in 1 year. Usually Congress takes years to get something done in Congress, and they've gotten some funding for it. So it's a start. The other thing I wanted to mention is that the final rule for CMS cost collections has been published. What has been sort of rumored to be happening for years is now real. Ambulance agencies are going to have to start reporting a lot of data to the federal government. I'm just going to read off a list of the people in our region who have so they're not collecting the data from everybody in the first year. They're doing they're what?
It's a 4-year program.
It's a 4-year program, but in the first year, everyone's going to be captured. In the first year, they're doing a sample. Durham Ambulance, Chatham Ambulance, Altamont Rescue Squad, Hunter Ambulance, Castleton Ambulance, Pittstown Emergency Squad, Ashland Ambulance, Nassau Ambulance, Boston Lake Emergency Squad, Clifton Park Half Moon, Hoosick Valley Rescue Squad, City of Waterloo. Sorry.
Time of day.
All right, I'm sorry. Clifton Park Half Moon.
Hey, hey.
I don't think I've ever lost her before. This is like,
You're losing the rest of us.
Hoosick Valley, Hoosick Valley Rescue Squad, the City of Waterville, Greenport Rescue Squad, and Capital District Ambulance. So those agencies will all be up in the first year. I've been appointed to a task force by NAEMT that is looking at how we can help small EMS agencies comply. For the most part, the agencies in our region that have been listed, or some of them are pretty small, they're going to be expected to provide the same data that a big agency that may have a finance person full-time on staff or a statistical person full-time on staff. So the question is how to help a small agency that has no staff, just volunteers, comply. So the NAEMT is working on trying to figure out what kind of, can there be programs that we put on a regional basis around the country, webinars people can tune into. Another thought was asking the billing companies that many of these ambulance agencies use to have put on seminars for their clients. So I wanted to make sure everyone knew that was out there, and more to come.
I have a question.
Yeah.
So where can I find those data points?
If you go onto the internet and you search for the Center for Medicare and Medicaid Services Final Ambulance Agency Cost Collection Rule, it was published in the Federal Register. I'm sure you'll find it on the NAEMT website or the American Ambulance Association website or other prominent EMS websites. And it's a multi-hundred-page rule, but in there you'll find the actual data points that will be collected.
And so it's a 4-year program. Have they decided year 2 who it's going to be, year 3?
No.
One quick summary. A quick summary is over 2,600 ambulance services nationwide have been selected to participate in the Medicare ground ambulance data collection system for the first year of the process. Every EMS agency will be selected during a 4-year program. So even if you haven't been selected this year, you will be selected over the course of the 3 subsequent years. Remember, if your agency is chosen and you fail to submit the required data sought by CMS, your agency will be subjected to a 10% reduction in reimbursement for the entire year. So it has some teeth, financial teeth into it. There's a whole list of things that are required for this study. And your billing company is not the person on the hook, it's the agency's on the hook
Right.
for the data. So your billing agency can help out, but ultimately it's the agency itself that's actually responsible for the data.
What's the deadline to provide the information?
It's all on the site. If you've been selected, your agency always been notified.
So it's next spring the data is going to be due. I think the important thing is that we, make sure that our rural ambulance agencies know about this, because if you're not tracking it, and, it sort of goes into your inbox and doesn't get read, a piece of miscellaneous mail from the government. So.
Well, I think that's the point. Is are they saying, okay, and we get an email on January 1st of 2020 saying I need these data points for 2019, or are they saying collect this information for 2020?
So the process is not necessarily that friendly. They're not going to hold everybody's hands to collect the data. They published a rule, and your responsibility as a Medicare participating provider is to know what the rules are. So they may send you a letter that says, hey, you've been selected, but after that, it's all your responsibility. The data points and the years for which, it's historical data, it's not data going forward.
Okay.
So so it's very different from an agency that may still have paper PCRs than an agency that has electronic PCRs. It's different for an agency that has a very sophisticated cost accounting system versus an agency that has a very unsophisticated cost accounting system. But they're expecting the data nonetheless.
So it's happening right now. Five-State Association is working now with the American Ambulance Association and the Bureau of EMS and Trauma in New York State to come up with a mini seminar how to do this. As soon as I get the information, I'll be more than glad to share it with the council. Chances are it's going to be a turning stone sometime in the first part of January.
Is that something that would be shared beyond the membership of your
Yes.
association for everyone?
Yes.
That's great. Obviously, the NAEMT may do something at the national level. That's not gonna be as specific to us as something that's done by the United New York Ambulance Network. So, thank you to Onion for taking that initiative for us.
The way we're looking at it right now, we don't encourage good data, everyone's gonna suffer in the system. The more good data we put into it, the more, hopefully, the more reimbursement rates we actually get into everybody. But poor data means not enough information, and CMS will cut us.
Right. Well, Les, if I could ask you just to keep this group posted as things develop, and keep Tim posted if there are things we should be communicating out to the EMS agencies in the region that may want to participate.
They're on more on the state issue as well, so.
Yeah. Got it. Okay. That concludes the chairperson's report. Any questions for me on any of this stuff? All right, into our issue discussion section. We have removed Remo staff incentive compensation formula for them from tonight's agenda. It'll be back next month. There have been some adjustments to the year end based on some late revenue that came in and some late, based on the timing of state payments for courses, so it's not baked and ready for prime time. So the treasurer and Tim and Dave and myself will be getting together to hash that out and bring it back to you. We do have some meeting comp discussions for next year. Deb Cuff started plotting out the calendar for next year's and noticed that the Monday of Memorial Day is our normally scheduled meeting. And so Tim recommended that we move the meeting back to the 18th of May. Is there any objection to that? I don't think we need a vote on that, just May meeting 1 week early. Okay. Secondly, Yom Kippur, Jewish holiday. The first night of it is Monday, 9/28, which is when our normal meeting is in September. Again, suggesting we move it back one night so as to not be meeting on the beginning of the holiday. And third, our December meeting falls on December 28th after Christmas, and the idea was to move it back a week again. So we moved 3 meetings back just for these. It'll be published on our calendar for the whole year.
Don't we normally do away with our Christmas?
Well, in the past, we have.
We
but
do,
that
but
doesn't mean-
we should have one scheduled for us to be able to do away with if we
Well, in
Yes,
case
we
there's-
wish
Or we just shoot it in the head now?
Well, we shouldn't shoot it ahead, because remember, we don't know what necessary, if there's a CON on the agenda that is timely, we need to sort of have a meeting scheduled, right?
We get a lot of people on the 21st.
So, well, look,
Hey, you.
are there any objections to those 3 changes? Tim, can I ask that we have a schedule of meetings published and sent out to the council, and also placed on the website, so that anybody can look on our website and know when the meetings are? Okay. All right. Next up is the schedule of elections for 2020 officers. Maria had agreed that she would stay on as the nominating committee chair. So we have that, usually have our election in January, so if you're interested in writing a nomination for serving as an officer, we have a chairperson, vice chairperson, the treasurer, and the secretary. If you would get a letter to Executive Director Tim Mirabwe, Maria would, by the dated December meeting, be the appropriate time.
Probably, yeah.
So that gives everybody 1 month to get a letter in to Tim, and Tim will turn it over to Maria, who will work with the nominating committee towards having an election at our January Remsco meeting of the officers next year. Any objections to that? Questions or comments?
Same salary?
Same salary.
I
Right.
think you should hold
Can we
out for
afford
a
that?
raise.
You can have as many percent you want on top of what we get, right? Okay, so operational reports, Dr. Daly, Medical Director.
So a couple of relatively quick things. The first is that I attended a stroke meeting last month in Boston. It was the Northeast Cerebrovascular Consortium meeting. Stuck around for an extra day in the end, and we presented a little bit about the NEC grant that we have just been awarded to look at regional stroke. Rob is one of our partners in this grant. It's a very exciting grant. We have $5,000 for the year. We figured it out, by the time we buy a box of donuts for every participating hospital in this program, we will have enough left to buy Dr. McHugh a cup of coffee. So what the ultimate goal here is to improve the systems care for stroke patients. There were a lot of really good lessons to be learned from some of the other programs at the NEC conference. We'll be talking about some of those at the REMAC meeting in December. So if anybody is interested in talking about stroke, that's what we'll be doing in December. So from something good to something that just leaves me rubbing my head, much like Jeff was doing a minute ago, psychiatric patients. Had the opportunity this week to have a meeting with the Albany County Director of Mental Health, Steve Giordano, some folks on the line from the Office of Mental Health, St. Peter's, and all of its facilities, and Albany Med. Something that was really, really nice was the collaborative approach that group took, and I know that you guys are used to hearing me use the word collaboration an awful lot, but the bottom line is that we all work together much better than we do separately. And it was very nice to see these disparate health systems working together to start to discuss psychiatric patients and mental health crisis folks. The next set of meetings will take place early in the next year. Ellis will be participating in those. Rob doesn't know it, it's going to end up on his calendar, as well as a couple of other regional facilities. The bottom line is that we have a mental health crisis. There are no easy answers. As we talked about at the last REMAC meeting, these will just be ongoing problems, but there are people trying to find ways to explore solutions and exploring ways to work together to make the process better. But there are way too many psychiatric patients. There are not enough places to put them. There are not enough resources to treat them, but we're trying. So, sorry not to have better news on that front.
Anything else, Dr. Daly? Any questions for Dr. Daly? All right. I forgot to introduce our guest at the beginning of the meeting, and I apologize. Tim Kelly is here from the Monroe-Livingston Regional EMS Council. And Tim is on a journey around the state, visiting different EMS councils, and to get a sense of how they run, just, I guess, for you guys to think about how to improve your council.
Absolutely. If, Mr. Chair, if I may.
Go ahead,
take
please.
a quick minute.
Mr. Chair.
As introduced, my name is Timothy Kelly. I'm from the Monroe-Livingston region. I essentially just came here from Rochester. So pretty much what I'm doing is I'm going around and I'm looking to see if all of the problems that my own council faces are unique or if we can commiserate together on them. And so far, it is the latter. What works really well in one region, one might not have thought of as well. And with me going through and talking with everyone, bringing forward different ideas, I'm hoping that we can all start playing closer to the same page, because we only have our state meetings 3 times a year. I know for myself, when I go to them, it's a whole lot to take in, and really a day and a half, and then we're off again, and we're trying to solve the world's problems in the entire state of New York, and we have a lot of different personalities throughout the entire state between the different regions as well. So whatever I can take from my own education, and whatever I can bring back for others to try to hopefully bring us together a little bit closer and a little more understanding is really what I'm trying to get at. So I would like to thank Mr. Chair for allowing me to come here tonight and for listening to your council as well. And I'll be available if anyone wants to talk afterwards. Thank you very much.
The visitors get to pay for the pizza.
Thanks.
Paramedic, that's
Okay.
that's it.
All right. Next up is Dr. McHugh for the REMAC and academic report. No meeting this month. Okay, next meeting is December 4th. Treasurer, PJ.
Yep, pretty simple, straightforward. First of all, typo error on the top of the page there. The right-hand column should say 10/31/2018 versus 2019. So, as you can see, we're still in a healthy situation. We have assets over $600,000. Timing is everything. You notice in the operating account, last year at this point during the month, we had received about $83,000 of grant money, and this year we received $6,900. So that makes a huge difference. Other than that, like I said, timing is everything, we're still in good financial shape.
Any questions for PJ on the treasurer's report? Okay, and PJ, which column is the 18, the bar rate?
All the way on it, all the way on it.
Okay, bar rate, okay. And I think that we'll have an updated end-of-year close for you to look at next month, right?
I should make a comment on that.
Okay.
Just like what you said earlier, there were some, because we're on an accrual basis, there were some income that did come in after we reported the financials at the end of September. So there will be a new audited, it'll be unaudited, but an updated financial as of the end of September. And that caused a little consternation on my part, which we were going to address. And on top of that, the the employees incentive program, that's one of the issues that we're going to work on because of a refined financial reporting from the training account now has led to a discrepancy in the way we've always done our incentive program for the employees. So we'll address all this in next month's meeting. Hopefully we'll have everything together.
And Tim, we've engaged our auditors, right, for next year?
Yes, I was gonna speak at the end of the meeting. I believe it's either the first or second week of December they'll be in-house.
Okay, auditors,
I believe it's the second week of December.
second week of December. Okay. Great. All right. There is no QI report tonight because the next meeting is the 4th of December. CON committee, there are no actions and Jim's not here, so we'll presume there's no report, and Tim talked about the possible actions. All right, information sharing, we have no DOH disciplinary actions to read into the record. Our course applications are listed down on here. There are some new comprehensive stroke centers that DOH is listing. None of them are in our region. Committee reports, there is nothing to report from the executive committee, has not met or had any actions, nothing from the finance committee. The New York State EMS Council, the next meeting is January 15th, so I'll have a report after that meeting. And next up is the nurses committee. Anne Marie.
So we met on, sorry, I have a cold, my voice is, usually don't have a loud voice anyway, but now it's really not loud. On November 6th, we met. One of our big topics of discussion was the linen issue and the supply issue. So hospitals are still being faced with the issue of hospitals that have kind of cut back on, on the, the hospitals that have cut back, like Albany Med with the disposable linen has affected a lot of the other agencies, which of course is affecting the hospitals. So those of us that are still using regular linen are finding that there's a lot of other EMS agencies taking the linen from us that are not getting it from other places. So we've noticed it now in Saratoga. There's a lot of other areas that have discussed the same thing from Albany that are running into that. Steve did send a letter to Albany Med in St. Peter's, and he had mentioned that at the last month's meeting, and St. Peter's had responded, and we had our Remo banquet. We talked to Dr. Bosco, who was gonna try to see if he could, push that along, and Steve reached out 3 times and didn't get any response back from Albany Med, so we're not really moving forward at all with that, and we're not really sure. I know from the nurses' side, we're really struggling with, what we're gonna do with the linen as well. Some of the supplies that are the issues is, again, similar things that hospitals are cutting back on what they're giving out to EMS agencies. I know Glens Falls has cut back and some of the other hospitals, so we're finding that our supply cabinet is like empty 3 times a day, and it never used to be. I'm getting phone calls from purchasing, or we're calling them, and because the EMS agencies are coming in saying there's nothing there, and the cabinet's empty. So we're not quite sure what we're gonna do. I did bump it up to our CEO, and because he had said just, he would take my lead or our lead as to what we wanted to do with what the other agencies are doing. So I mean, I certainly don't have the answer, and, it's just that we know that every month we're struggling and we're losing lots of money now, which we never really found that to be an issue as much. So, I don't know, and with the OmniMed piece, if there's anything, we were hoping that that might be something that
I
we
don't
could-
have an answer for you about Albany Med. I received a communication directly from the CEO saying that we could talk about it, and that was the hit, that has not yet been followed up on by him and his office. I think that Dr. Bosco at St. Peter's Health Partners has been willing to hold off on St. Peter's making any additional changes for now, under the hope that we can come up with a regional solution. But, you know, as Anne Marie described, I don't know how long anyone else is gonna hold off if we can't come up with a regional solution, because what's happening now is people are taking more from the hospitals that have. I'm personally concerned because now we're in wintertime, and, you know, the blankets are an issue. You know, my best advice to any agency now is we have to start making our own blanket arrangements, at least in the short term, to keep our patients warm. And I don't know if, I don't know where this ends up, but we can keep working on it. And those of you that have, you know, contacts at the hospitals should keep asking them, keep encouraging them all to come together and work with us on a regional solution that works for everyone. That at least make sure we have the basic supplies we need to keep the patients warm in the wintertime. So.
We discussed ketamine. Low-dose ketamine will be going to a lower-dose ketamine, 30 milligram ketamine, 50 ml bag. Has been providing good pain relief. There has been no change at all from the Board of Nursing, despite many letters that have been sent to them regarding nurses administering ketamine. So that's, we'll just keep continuing to do that. Interfacility transfers, we discussed the use of standardized order sheets. Dr. Daly, did you wanna say anything about that? Has that,
Not yet.
when we talked about it at the meeting?
Yeah, no, it is a good idea, it's something we should pursue,
But
it's
isn't
not
anything-
something that has risen to the ability for us to start looking at it.
I didn't have a lot of notes with that, so I wasn't sure.
Exactly.
We also talked about the transfer of psych patients, and, you know, the issue that we are having in the EDs with all of our psych patients as well. As Dr. Daly said, we're, every one of us are faced with that, and every day our numbers are increasing. I mean, we have an area of 6 beds in our emergency department, and on most days it's just spilling out into the main ER, and you have to have a one-to-one sit, which, you know, we're all faced with, and we don't have enough of techs to do that. So that's really been an issue, trying to get them evaluated quickly and get that medical screen exam, and, you know, and then once we do disposition them, you know, where are they gonna go? We have 16 beds at Saratoga Hospital, and we've been down to 12 beds because of construction and because of the Joint Commission ligature risk directives that they have. They came to us in February, so they're really clamping down on the ligature risk, so they had to redo the entire inpatient mental health unit. So they've been down to 4 beds they've been down 4 beds since February. So that's a real crunch for us. So we're holding admissions that would have normally gone to our facility, trying to transfer, but there's just no beds. And of course, the pediatric and adolescent patients the numbers are increasing, and, you know, we have 4 wins, but most days they're full as well. So we're sending patients to Katona and kind of out of the area, which a lot of hospitals are faced with, and they don't have Pine Field, and there's not a lot of beds either. So, we talked about the naloxone program. Saratoga has already done the kickoff with that, and we're giving out the kits in the ER now. Most of my nurses have been trained to do that. Most of my lead nurses and patient care coordinators, myself, have been trained to give out the kits to families or patients that are presenting in the ED. NIH stroke scale. We talked about incorporating that into our nursing assessments, and some of the hospitals have that already. And we just discussed that whole stroke protocol, and we all have stroke protocols, but we're talking about really having that NIH one. And we're also trying to increase the number of nurses who, to get on the committee. You know, it's the same ones who kind of participate, and we just don't always have a great turnout. Last month, we did have a pretty good turnout, but it's rare that there's every hospital represented and everybody's busy, but we continue to keep reaching out. And there's some hospitals that we still haven't, really don't even respond or come to the meetings, but, which is unfortunate. And then our next meeting is gonna be in February, first week in February.
And are there any hospitals that do not have a representative at this time?
Glens Falls, the VA, Ellis. Yeah,
Matt's been going.
what's that?
Matt's been going. That's not.
No. Columbia, we haven't heard, he's reached out to me a couple of times for other things. Has, but has not been able to attend, I guess, or
Do enough for the Saratoga one.
one time he
One
did,
time.
yes, once, right, you're right, you're right.
Maybe we can meet offline about
Participation.
strategies about encouraging
Yeah.
participation from the
Yeah.
VA, Glens Falls, Ellis, and Columbia Memorial.
Yeah.
Even though I'm guessing Rob's writing something down, so.
I'll talk to mine tomorrow, and I'm sending a message to the medical director of VA now.
Okay.
Okay, perfect.
Okay, thank you. Any questions for Anne Marie? PJ, MCI committee?
No report.
Lynn, anything for membership?
The letter is written. I realized before you asked my name that I didn't print it off for you, but I will forward it to you and Mr. Miraboli.
Okay.
Just go through it, make sure it sounds,
Okay.
adult-like.
And this is the letter to all the agencies telling them we have some vacant spots. And
At-large
please-
spots,
at-
yes, sir.
Please send in your interest.
Everybody,
Okay,
come on.
great, okay. Great, thank you. Nominating committee, anything, Maria, you would add other than what we
Yes, and
talked
next
about
month.
before? Why are you laughing at?
Sorry.
Okay.
No, I'm sorry, no,
um,
nothing other than
okay.
what we discussed before,
All right.
so.
Brian Wood is not here tonight for the awards committee, and my presumption is that sometime in probably February, we'll receive the awards information. I think one of the things that we'll probably talk about is that this year we chose to award a non-physician ER practitioner. I think we called it.
It was a physician,
it was a
physician
physician
assistant,
assistant.
PA of there.
But I forget what we called the award, but there is no statewide award, and I think we will probably work on talk about here whether we want to create an award in perpetuity that would be a non-physician, either a nurse practitioner or a PA award. And I know we had come up with a name for it last year, and I don't know what it was. I assume nothing from the bylaws committee tonight, Lynn?
No, sir.
Okay. All right, county reports, Albany County.
No report.
Okay. Columbia County.
Columbia County, I had a good meeting last week. Time goes by. Had a presentation from Dr. Weisberg from CMHER. As you know, they're no longer doing OB, so there's been some consternation about that, some problems with it and difficulties. So came to present what's expected of EMS and what's expected of the ER during this, obviously, transition. So that's been an ongoing, I don't want to say issue, but it's different. The other thing we discussed is, as a CCMS system, trying to bump the low acuity calls when the system is strapped to kind of stack them up. So our medical director is involved in that, Dr. Stippa, and he is obviously going to get together with Dr. Daly and see what we can do about that.
Okay, Greene County.
Steve Brocato's unable to make it tonight. He got stuck working, but he sent me a brief report.
Great.
and this is what Steve writes. The Greene County Legislature has approved funding for a fifth medic truck to primarily cover the underserved towns of Prattsville, Lexington, and Ashland, although it will still be part of the system. It will be stationed somewhere in that area. They hope to have that truck in service by April 1st of 2020.
Oh, great. Okay, thank you. Kathy, you want to swear?
Well, as Jim said, we have one agency that just is in the process of going out of business and transferring their CON. Our large class that we spoke about a couple of months ago that's being held at RPI campus, I think there's 40 to 45 students in that class. Because of the school schedule, they're going to be wrapping up in the next couple of weeks. That's an accelerated class because of the school calendar, so we'll see how that goes. We're already planning a new EMT and refresher class in January to be held at WF Bruin in East Greenbush. I don't have exact dates on that yet. And the other news, just to let you all know, sitting at the end of the table, Lynn Kane, I believe, she can correct me if I goof this up, was just elected president of the Remsco County Fire Chiefs Association to begin in January. Is that correct?
That is true.
Okay, so congratulations to her.
Congratulations, Glenn.
Thank you.
All right. Saratoga County, any report? Jim, Schenectady.
No, our meeting was canceled in November, rescheduled to December, so no report.
Okay. New business, the Leave Behind Naloxone program. Dr. Daly, is that, you working on that?
Yeah, so the Leave Behind Naloxone program is just about ready to kick off. It's actually going to kick off in Columbia County. PJ has been a huge advocate of this, as has Sheriff Bartlett. Anand is going to help me with some of the miscellaneous last pieces to put in place, and we will have Leave Behind Naloxone available for agencies in Columbia County very shortly. So I'm excited about that. Very excited about that. If I may, before we go to something else, I would like to make one quick motion. If I may, it has nothing to do with Leave Behind Naloxone. It actually has to do with the protocols. Thank you. We did an app update. The app update, we had budgeted for half of a $7,000 potential bill. The actual bill is coming in at $45.75, of which we will be ultimately responsible for $22.87.50, depending on the total number of regions that chip in to help out. At this point, I know that many of the regions have already said that they would chip in. What I would like to do is, if we can authorize Tim to spend $1,075 more than we had originally planned, so that we can cut this guy a check, so that we have paid our bills, and then Tim can work to continue to collect the money to get it paid back.
So the motion is to spend
$45.75, with the expectation that a significant proportion of that will end up paid back.
Is there a second motion?
I'll second.
Second, is there any discussion? All right, all those in favor say aye.
Aye.
Any opposed or abstentions? Okay, the motion carries. All right, under new business, if anyone would like to make a motion to make a donation to either the Alzheimer's Association or Community Hospice in memory of Judith Retzloff, I think that would be definitely appropriate for us to do at this time. Okay, well, when, okay, we need,
Okay, did you
when-
make a motion, sir?
well, I don't make motions, so
Okay.
you can make
That's
the
why I was
motion.
raising my hand.
Okay, is $100 appropriate?
For each,
Okay,
I make a motion that we make a $100 donation in honor of Judith Retzliff to both the Alzheimer's and the community hospice programs.
okay, second?
Second.
Any discussion? All in favor?
Aye.
Any opposed? Okay. Tim, can I ask you to arrange to have those made, and then also if somebody might send a letter to Steve and his family, on behalf of the Regional EMS Council, expressing our condolences.
Yeah, we'll get a
Letting them know.
sympathy card as well, yeah.
Thank you very much.
Is anyone going to the commitment service tomorrow besides me? It's up at Saratoga National Cemetery. No? All right.
I may try to, depending on what's going on here tomorrow.
Is there any other new business?
I guess you guys have known that the governor's budget's gonna be announced in January. We were told by our lobbyists that chances are the crossover piece and some of the loan funds could be back on the docket right now for cuts. So I'll be reaching out to you guys again for support for the EMS system in general, to actually, tell the governor's office it's not a good idea for EMS.
Can you just describe for everyone what the crossover piece is?
If somebody's got dual eligibility for Medicare and Medicaid, the Medicaid piece helps pay the differential between the, what Medicare pays and what the beneficiary is responsible for. If that goes away, it's hundreds of thousands of dollars throughout New York State.
So that is right now Medicare. Medicare has a fee schedule, and Medicare pays 80% of the fee schedule, and Medicaid pays the other 20%.
A portion of the 20%.
A portion of the 20%. And the governor's proposal will be Medicaid won't pay that anymore.
That is
or
correct,
something
and also
like that.
the supplemental money that we usually get taken away as well. The reason why is that Medicaid right now has, I guess, a couple $1 billion shortfall. Some of that money was from 2019, has been shifted over to 2020.
Right.
So there's an issue there as far as how's Medicaid going to be funded.
Okay, so the supplemental payments will be on, right, okay.
The nursing home where we took the hit, hospitals right now are going to be taking a hit, and with that EMS is going to be taking a hit as
I
well.
think everyone's gonna take a hit. The state has done something that it's done in the past where they shift the last payment to providers for a year forward into the next fiscal year to create some space under the cap. That's not even close to enough this time, so I think it's gonna be budget. Tim, if you could make a note that we should have on the budget for the January meeting, state budget update. And Les, certainly we would appreciate anything that Onion would like to provide to the council.
We have
or-
3 lobbyists working, to get
Right,
information.
so I don't know if you even wanna, if there's something that they have, it's a memo to bring, or if you would wanna talk for a few minutes about the state budget at the January
We
meeting.
intend to actually make that information as public as possible.
Well, that'd be great, and I appreciate again that you're doing that, okay?
I'm sorry, can you just repeat again? It's the crossover payment and the Medicaid supplemental payment, right?
Correct.
Those are both on.
The same as last year.
But it'll be a harder fight this year, and the people that were helping us a little bit will have their own problems, right? Because the hospitals were kinda nice to us last year.
We still have
They're
good
gonna be on
relationships
fire.
with Haney and that group, and
But they'll be under fire too, so. Okay, any other new business? Lynn?
I just wanted to say thank you to those who donated, brought me socks. For those who don't, I collect socks this time of year to give to the homeless shelter. Last year, with your assistance, I gave away 300 pairs to Unity House and St. Joseph's House. And this year, anything over 300, or it's closer to 4, I'm gonna divvy it up and take some to the city mission in Lower Albany.
Thank you. Tim, you have something?
Holiday gift cards.
Okay.
Typically, at the November meeting, I approach the council and ask for your approval to purchase $50 holiday gift cards for the staff. 8 staff members times 50 would be $400.
I think Jim's making the motion. And we have a second. Any discussion? All those in favor? Any opposed?
Thank you.
Okay, carries. You know, we should next year put this in the budget.
Outstanding idea.
That way we don't have to, you should have it in the, just put $400 in the budget each year for that. That makes it easier. All right, is there any old business?
I don't think I
Yes.
heard you.
I'd like to just make a little bit of a clarification. I think it was the last meeting brought up an issue with the Hoosick, Town Hoosick Rescue Squad going ALS, and you kind of caught me off guard. I had not heard anything about it. But I've since followed up, and they tell me that they are not making any moves to go ALS. What they are doing is looking at BLS EKGs.
Oh, cool.
So
Okay. Excellent.
So they're working on that.
All right. Any other old business? Any items from the floor? Okay, our next meeting date is December 16th. Lynn?
Well, if nothing urgent comes up, would we like to entertain a motion, maybe? You know, not to have a meeting?
I second that motion.
All right, we have a motion to suspend and have a
See
meeting.
that coming.
Tim, do you anticipate that we will have CON action from any of these partners that are working on things at the
I don't think so, not by
Okay.
then.
So we have a motion to second to suspend the December meeting.
I do this every
And our
year.
next meeting will be in January. Does anyone know the date? Quick, anyone can do a quick look at the calendar?
So that pushes everything back,
What?
that pushes the business we have scheduled for December, I agree with it, but the nominations and the letters about open seats, the at-large seats will move to January.
If I may, we've normally rolled over, when I ran the nominations, we rolled it over to January, a week or two before. What do you think about that?
I think that for somebody to pen a letter to the executive director between now and December 16th is not a really tough thing to do. And one of the things we have to make sure is we have people willing and interested in serving. So let's get the letters in, even if the election is gonna be held a little bit later. I think that sort of makes some sense.
Well,
Would
the
you agree,
elections
Maria?
would be in January.
The elections will be in January, right?
Well, the nominations will be January, so that means the elections would be in February.
We have always done it
Okay.
in January.
Right, well, yeah, the nominating committee can, well, we'll go back and check the bylaws and make sure we do it appropriately in case there's anything that we're not, but we usually have the elections in January, and we usually don't have a December meeting, so I'll just confirm with the bylaws that that's done appropriately. Okay, so has anyone figured out what the fourth Monday of January is?
27th.
27. Jim?
Just a question, if we don't have that meeting, how is that going to affect the incentive comp for the employees?
That's a good point, then I guess that we'll have to deal with, Tim, is that okay, we deal with it in January, or is that really put a?
Can we do it by email if you guys come to a conclusion prior to that?
Or maybe we should just have a meeting.
Can we authorize executive officers to, as long as all the criteria is met, to divvy it up?
I would
There's nobody from Schenectady would make that meeting anyway, because we have our county meeting that night.
Okay,
If it's not the end of the world, I think it'd be preferable to put it off till January, because I think we're gonna have some changes that we need to discuss.
so, I think, I would take it the treasurer is probably the best authority on this, that we got some stuff we need to figure out, so.
There is no best authority, I'll take that back.
Okay, is it good, we should take the advice of the treasurer, how's that? So I'm realizing we're not having a December meeting, and this will get put off then until January. And I imagine that the executive committee can work with Tim if this creates any short-term hardships that we need to mitigate between now and the end of the year. Would that be acceptable, PJ?
Absolutely.
Okay.
Or unless you wanna distribute like half the anticipated.
That was sort of what I was saying, is that perhaps if we would, someone would make a motion to authorize the executive committee to distribute half of the pool before the end of the year, and then we can talk about the rest of it later. Would that be,
So moved.
I'll second that,
Okay.
better than nothing.
and you, PJ, you're okay with that?
We're still gonna meet, correct?
What?
We're still going to meet.
Oh, yeah,
Yeah.
yeah, but that makes it easier. Okay, so, Tim will be, by this motion, Tim will be authorized to distribute 50% of the incentive compensation funds before the end of the year, and the remainder will be discussed at the January meeting. Any discussion or questions? All in favor?
Aye.
Any opposed? Abstentions? Okay, so I think that, that's done. We have a motion, did we vote on the motion to table? Well, technically, we shouldn't have done that motion because we had a motion on the floor, so I apologize. We still have the motion on the floor, for canceling the December meeting, and don't write
We're
down.
usually a lot more organized.
Don't write down. Okay, So we have a motion on the floor to cancel the December 16th meeting. Our next meeting will be January 27th.
And a second.
And a second.
And a second.
I assume there'll be no further discussion. All in favor can say aye.
Aye.
Opposed? Abstentions? The motion carries. The meeting's adjourned. Happy holidays, everybody.
Make a motion to adjourn.
Second it.
Thank you.
Yeah.